My name is Sophia Neisinger. I'm a physician at the Institute of Allergology in Berlin at Charité University Hospital. And today I will be talking about digital health evolution in healthcare. So first of all, I will give you a short introduction about it in general, then why you should give it a chance, and what's coming next in the future. And after that, my colleagues are going to dive a little deeper into our first digital health application for you as a chronic urticaria patient. So just in general, digital health is defined as the knowledge and practice associated with the development and use of digital technologies to improve health. And you've all seen those headlines. The COVID-19 pandemic highlighted this urgent need for effective digital tools. And so suddenly digital health has been all over the news in the past years. When COVID hit, you know that a simple family doctor visit wasn't so simple anymore, and telemedicine, so seeing your doctor via Zoom remotely, suddenly somehow was possible, and it became a priority in healthcare around the world. So this need that we all knew that was coming at some time in the future suddenly was there. And it's quite interesting to see that in less than a year, according to some research that was done by Accenture, the number of patients that use telemedicine, so seeing their doctor, not in the clinic, but on their mobile phone, on FaceTime, or on their laptop, has been 4 times higher than before. And as you can see on this chart, this is only showing the first 6 months in 2020. So not only those numbers went up, but also the money that got invested, for instance, in healthcare startups that were focusing on digital health has been as high as, and is still as high as never before. So here you can see a list of examples what digital health is, what is part of digital health. And first of all, electronic prescription. This is something that, for instance, in Germany, just has been established a couple of months ago and really brings huge advantages with it. For instance, as reducing the chance of errors. And you all know, we as physicians, we have a very poor handwriting. So imagine the pharmacist, what she has to go through every day figuring out our handwriting. And of course, this is solved by a very simple electronic prescription. Then we've got telemedicine, which is probably the digital tool we've heard most about in the last years, but also at a very basic level, a more simple digital tool such as text messaging. This can already provide essential health information, for instance, in remote areas where older patients do not have a smartphone or laptop. And then we've got electronic health records. Of course, they can integrate consultation, diagnosis, and treatment records to better coordinate individual patient care between physicians. So like this, imagine you're having an X-ray scan done, and the next week when you're doing your yearly health check at your GP, he already has access to your X-ray scan. So some of you might say, well, that's already working in my country. Well, in most of the countries around the world, it is not yet. But Sweden, for instance, is a really good example where this already works quite well. Then we've got health apps, our focus for today, which I will dive deeper in a little later. Smart devices, I'll talk about that in a bit. And then we've got big data. So big data sets. This always comes in a sentence when talking also about artificial intelligence. And our patients, you're always asking, what is artificial intelligence? And so to sum it up in a very easy way is artificial intelligence somehow combines, on the one hand, computer science, and on the other hand, with huge data sets to enable problem solving, and it's somehow simulating human intelligence. And so you shouldn't be afraid of artificial intelligence. It already helps us as physicians, for instance, for the interpretation of radiology scans, and in the future to support physician decision-making. And so now you're wondering, why do I, as a chronic urticaria patient, need a digital health tool? And that's quite simple. So we built an app. It's called Cruise, and we did not build that because everyone is building some kind of digital health tools. We are not entrepreneurs, but we as physicians saw some problems and we found a solution for it, our health app Cruise. So when you're going into the clinic, when you're seeing your physician, on the one side, we have to see your skin lesions. Yeah. Either you have them or you show them to us, searching through your phone, through pictures in your gallery. Then normally we draw some blood to get some markers that are interesting for us. And then more importantly, what we really need is you to fill out questionnaires, so-called patient-reported outcome measures. These are validated questionnaires. They really help us to say, how's your disease activity? How's your disease control? And if it has an impact on your quality of life. So those questionnaires, you normally fill them out before your doctor's visit in the waiting room. And then there's a score that gets calculated. And this gives us very important information. So to have all those paper questionnaires together with your pictures in one tool, we decided to build an app. And this app is called Cruise. I still will tell you a little bit more about, but just to sum it up real quick, here you can upload a picture of your skin lesion, so you don't have to scroll through your gallery anymore. You, in a very easy and convenient way, get to answer those questionnaires every day on your phone. You also get notifications. You don't have to really think about it. And then in the end, you can send a report, including pictures of your skin lesions and the results of your questionnaires to your physician. And now imagine you just got COVID, but then you've got your appointment with your otorhinolaryngologist. You've been waiting for that appointment for a couple of months and you really want to see your specialist, but you can't because you've got COVID. So now you can just send him your report. You can use telemedicine or just have a telephone, like a phone call with him, and like that have a really good doctor's appointment without being there. So it's really important to say it's not that easy to build a digital health app. We have a lot of stakeholders involved. So who are they? So of course, most important is always you as the patient. Then we've got physicians or companies, for instance, that come up with an idea or are already using a technology to collect data to improve your therapy. And all of this is normally controlled by the country's government or in the European Union, for instance, by the European Union itself. One example here is, for instance, the medical device regulation. This is a regulation controlling health apps declared as medical devices. So in Germany, for instance, you can get a health app on prescription, so your insurance pays for it, and this is regulated by the European Union itself. Then we also have, for instance, as another stakeholder, software companies. These are, of course, not only important to build our medical devices, our health apps, but also when it comes to cybersecurity, because nowadays we all know hospitals must accept that, unfortunately, threats are no longer just an eventuality. So here, all stakeholders have to work together. The question our patients always ask us is, who owns my data? If I have a health app, who gets my data? So the data of such a health app is normally owned by the company or by the institution behind this health application. With our Cruise app, this is a UCARE, Urticaria Centers for Excellence, Urticaria Centers for Reference and Excellence, that's how I say it. And so this is a non-profit organization, and we store and own your data. We store it together with our software company in the Netherlands according to EU standards. So you can always check the data regulation form in every health app and see where your data is going. Then the other question is, why would you partner up with a pharma company? And this is actually quite easy to answer. So we as physicians in Berlin and Germany, we know our patients here, but we want to get our app, our Cruise app, we want to make it available for patients all over the world. And those pharma companies have the network and are in contact with, for instance, patients group that helps us to bring it to more patients. And then you are always asking, do they get my data? So the pharma companies we work together with, Cruise, they will never get your data. They can get results of data analysis or data in an anonymized form. So don't be afraid of this at all. So why are all those stakeholders at all interested in digital health? Well, I know living healthy lives is our main goal. And as healthcare costs are rising globally, digital health is actually the #1 solution to provide efficient healthcare. I mean, now it seems like it's very expensive. We have to put a lot of money in, but at some point in the future, we'll see through digital health, healthcare costs are going to be lower than before. And now we're coming to the exciting part. What's coming next? What's the future of digital health? So there are more and more tools coming, such as smart mirrors, smart lenses, or even smart inhalers. But there are also some tools we already have that are getting better and better, such as wearable fitness technology. You all know them, Fitbit, smartwatches, they are seen as mainstream, and the future of wearable devices shows no sign of slowing down. So according to some research done from Insider Intelligence, more than 80% of consumers are actually willing to wear fitness technology. And this is so interesting because we see patients in a clinic very hesitant to download in the health app because of their data. But at the same time, they're very willing to share data through their smart device with some other company. One of the big companies that have a very famous smartwatch on the market, you all know it, they just got an FDA approval for an ECG sensor. So what is an ECG sensor? This just monitors your heart health. And what this ECG sensor does, if your heart stops beating, the app directly calls 911 in the US. And so this is very interesting that such an lifestyle device now gets to be a digital health tool. So now you're wondering why there's a toilet on the right. Maybe the most important door that we have to open to advance preventive health in the future might be our bathroom door, making unconscious health checks, maybe of like a urine analysis in our bathroom, something that might be the future. So to sum it up, digital tools are a game changer. And we just want you to give it a chance. Try out Cruise, maybe let it be the first digital tool you are using, and help us to improve it. We are constantly adapting it to your needs, and we want to make Cruise better and better. So thank you so much. This was a lot of fun for me. I think we should do this webinar again, maybe in a couple of years, to see how far we get with Cruise, and to see maybe if you all have already smart toilets at home. So thanks a lot. It's Eiste, you're next, and also thanks to our sponsors for today.
Of course, thank you very much. Very exciting presentation. Very exciting future coming right up. Yeah, I can't wait to see how does that look like. And just to put a few highlights on your presentation, what would you say are the major advantages that patients actually receive when choosing to use digital health solutions? Because let's admit, it's still, at some parts of the world at least, it's still unconventional way to get your healthcare services. And you might not, notice right away the benefits that it might offer you. So what would you say are the biggest advantages that people receive?
Yeah, so it's just way more convenient in your everyday life. Imagine you're traveling somewhere something happens to you, but you have some kind of condition, and it will be very much more convenient. But it's very important for everyone, for patients to know it can't be perfect yet. It's a revolution. It's going fast right now due to COVID, but it cannot be perfect. But still, try to use it. Give feedback to everyone that is behind every digital tool, and then I think we're on a very good way.
Of course. So I encourage our participants to actually share and use this opportunity to share your experiences with digital health tools that you have already used. Maybe you have some experiences that you would like to encourage others also to try it out, or maybe you face some concerns while receiving digital healthcare services. So feel free to share that with us, and we can discuss on it later on.